It's so great to have you here today just to talk about your upcoming training and get to know you a little bit better. How are you doing today?
Doing really well. Doing really well. Glad to be meeting with you. Excited about this training and hoping to talk a little bit more about it.
Yeah. Well, just off the bat, can you tell us a little bit more about, this training is for suicide and crisis assessment, things that all of us need as clinicians and even not clinicians when you're working with people and specifically adolescents as well as adults with pervasive mental health. You need to know this information. But could you tell us a little bit about your experience? What got you into doing this type of work?
Sure. Yeah. I started working for Shasta County in 2009. And one of the first things that they had us do was take an on-call rotation for crisis evaluations in the emergency department. And so kind of learned by getting thrown into the fire a little bit and exposed to crisis situations. It was new to me at the time, but going through that process, being certified to write 5150 holds and learn how to evaluate for the criteria for 5150 hold. Over time, I found that that was the type of work that I seemed to enjoy the most, being able to get in, meet somebody and try to rapidly develop some rapport and try to make sense of all the wild crisis information being thrown at me and hopefully come up with a good decision for somebody to start sort of the trajectory of their treatment. So I started, I guess that would have been my first exposure to crisis work and doing more intensive type suicide risk assessments. And so over time, moved into a supervisory role over crisis programs. And so that became more important for me to understand what's behind a really good suicide risk evaluation. And so just really dove into it, tried to learn as much as I can, tried to refine the craft as much as possible, teach people about it. I noticed that clinicians, kind of like myself, when I first started, a lot of clinicians, they'll have a lot of some anxiety, some fear, some trepidation going into a crisis situation, some nervousness maybe around even broaching the topic of suicide. And I found it was more because they, not so much that they weren't quality clinicians, it was more that they just lacked the understanding of, okay, if they say, yes, they're thinking about suicide, what do I do next? It's just knowledge and awareness of what are kind of the best standard steps to take after we get past that first question, and more specifically how to pull that out of the individual client that they're working with, and then also understanding the resources that are available in their community. So it was really more of a knowledge issue, and so I'm always excited to be part of an opportunity to teach.
Yeah. I know that in the beginning, or at least for me, it felt a little bit like opening Pandora's box. But as you start to feel comfortable, you realize it isn't that. There's very established and very structured things that you do. There's a lot of science behind it, actually. And so while it's a crisis, I feel like sometimes there's more structure for crisis assessment than there is for even other areas of clinical work, like grief and loss. Like there's great stuff, but you don't necessarily have an established approach.
Mm-hmm.
Whereas a crisis, there really is a pretty finely honed protocol that we do.
Mm-hmm. Yeah, for sure. I think your role and your focus becomes really narrow at that point, and that's a good thing. It can help make it really clear what you're trying to do in those situations.
Yeah. Were there any things that you struggled with in the beginning? You said, you walk in not knowing what to expect. Any areas that you grew in and developed?
I think sometimes when you're hearing somebody talking about their experience and what has ultimately led them to be thinking about hurting themselves or thinking about suicide, there was this interesting idea about, some people, gosh, if I really put myself in their shoes, that makes sense. It makes sense that somebody could get to that point.
Yeah.
And so that was interesting for me. I can't really say personally I've been, in a situation where I've really been thinking about suicide, but to really understand someone's story is to really understand that, gosh, suicide does seem like a viable option at some point. And so just knowing that exists for a lot of people, that we know, a lot of people in our community, sometimes people in our family real close to us. Sometimes that's a very real option for people in their minds, at least at the time. And so getting to know, that it can be a logical thing for, for somebody to get to, given their life experience.
Yeah, I know that working with new supervisees, this topic can be really alarming, and putting yourself in someone's shoes who is seeing this as a viable option, we often feel distress doing that. And I think we are supposed to. It's hardwired into our brain to survive. And so we should feel distress thinking about suicide. If we don't, that's actually the part that we need to get support in, because it should be alarming. But being able to overcome that, to support someone who has gone beyond that, and recognize that that's not that isn't how you are feeling. That's your client that you're empathizing with. Yeah, those personal boundaries, that sounds really important.
For sure. Yeah, something I was hoping to touch on in the training is balancing your humanness with your expertness. So suicide for mental health professionals, that should be our area where we feel comfortable. Firefighters are really good at dealing with fires. Other types of professions are good at dealing with their specific things. Suicide is something that mental health professionals, that should be something that we're really good at. So balancing that role as an expert and then also not losing that human touch is really important, because in crisis situations, it's important to take a very directive kind of stance and gather information, almost dig sort of like a detective. But when you're digging like a detective with somebody who's in a very fragile state, that could lead to some more negative outcomes. So we're just balancing that idea of human touch and your expert role.
Yeah, that's really good. And do you touch on, I'm sure that you've seen this in your work, clinicians who were experiencing some secondary trauma after processing with a client or stabilizing them? Any tools that you have for that?
Yeah, for sure. I think the biggest issue with that becomes awareness. Secondary trauma, vicarious trauma, it can be really insidious and sneaky and build up over time. When we're working with folks in the emergency department, sometimes they, even when we see them and then they go home with a solid safety plan, there have been times where something really unfortunate has happened and, they come back deceased, back to the same hospital, and we learned about that. And that can be a really tough thing for our team. So awareness that those things are creeping in. I know that when something like that happens, maybe a month or so could go by before somebody starts to notice that they're more distracted than usual. They're not really picking up on details at work. They're noticing some emotion or some anger outbursts in situations that they would never have it otherwise. And so just knowing that it's coming, being able to bring it up, being able to reach out for the resources that are available, knowing the resources that you do have available to you. And so, yeah, there's just that awareness and just the idea that something that could happen. Even if you're a very solid, experienced, seasoned clinician, there are situations that can hit you just right to where it will affect you. And so for someone to be more specifically in this type of work and never be affected, I don't know if that's possible.
That's a great point. At some point, if you're using your humanness, you're going to be impacted like a human.
For sure. Yeah.
One of the things I appreciate about your instruction style is that you're so grounded and calm, and I see how that must be such an asset in your work. Do you have any tips for keeping that grounded serenity during crisis?
Yeah, I think just knowing that in a crisis for an individual, as they're talking to you, there's a good chance that things could seem pretty convoluted, that the truth could really seem unclear, and there could be a bunch of different things flying around at the same time, maybe some contradictions, things that don't make sense. And so I try to understand that if I'm picking up on that from just talking to them, internally it's probably 100-fold and 100 miles an hour of all sorts of different confusing thoughts, conflicting feelings, you name it. And then add on top of that that their family or their support network is probably also feeling that and perhaps has been feeling that for a long time. So just knowing that you're going into something that's likely quite chaotic and people will be looking to you, and it will be your responsibility to a certain degree to be that calm, to be the foundation of what is actually accurate, what's more objective, what are the facts of the situation. Being that person that's able to see through the clutter, so to speak, and make sense of what's going on in front of you, it's really key. And I think when somebody is in crisis and they might be thinking of hurting themselves or they're thinking about suicide, being able to have a professional that is stable in those moments can go a long way, not only for that moment to maybe kind of co-regulate them a little bit. I've noticed that it can be really helpful in setting up the trajectory of their treatment as well, knowing that there are professionals that this is not new to. Not that they're belittling their experience, but that you're working with people that know what they're doing and they are going to be able to help you, and there is help available. I think that starts to light that little tiny flicker of hope for some people, just knowing that there are professionals that can help. And so being able to be calm, stay focused, gather information accurately, communicate clearly, those things all play a really important role on like several different levels of a crisis.
Yeah. I was thinking in my head what I do to get to that point, but it made me think, do you have like a little mental prep routine you do before you walk into this situation? As you're sitting in your car or in your office or whatever?
Yeah, for sure. I do. I try to get my body as calm as possible. I kind of tune into where my breathing is at, where my heart rate is at. In the training, I was going to talk a little bit about one intervention called acceptance and commitment therapy. And so there's a lot of mindfulness components that go along with that. And so some things stolen from the world of mindfulness to get myself in the present moment. Another key part of mindfulness is without judgment. And so I remind myself that I am not part of this. I'm becoming part of this as a professional, but I am not the reason for this crisis. I am not the one who owns this crisis. I'm not the one who really owns the outcome of my crisis. I come in and do the best work I can in a good faith effort to help, but ultimately, whichever way it goes, I don't own it. And so there's a certain level of detachment in a professional sense that allows me to get even further into the crisis with the individual without experiencing that disarray myself.
Gosh, that's so profound. I don't own this crisis. I'm facilitating the best chance at healing, but ultimately, what's in your control, what's not, and feeling
Another
supported.
part of that, as I was just thinking, that another part came up. There's and this goes in general too, but definitely when doing a crisis type evaluation, I do see it as an honor to be able to join somebody's experience, whether that be a crisis experience or even if it happens to be in a different setting in a more joyous situation. In our roles as mental health professionals, people open up their inner worlds to us, and I do see that as an honor. And so I respect the situation as well. And I think that helps me not take the situation lightly and to be more diligent in gathering accurate information and making sure that I do my due diligence and explore all the different possible avenues or corners or what might be involved in the situation. So I think honoring the situation, honoring the individual for being vulnerable to the point where you can join.
Yeah, I really like that edge that you're walking between of professional calm, but not cold and sterile, loving and supportive, but also the right balance of sub not subjectivity, objectivity, but
Mm-hmm. Yeah.
also, yeah, that's a really unique skill set, and I think applicable to all our clinical work. Really, you can get too involved, too emotional, but also too underconnected,
Mm-hmm.
too detached. So yeah, I'm really looking forward to learning more about just that balance. Sounds like you bring a lot that you cultivated to this that is making it so effective in regards to also using that protocol. So.
Yeah.
Well, who could benefit from coming to this?
Well, certainly folks that are most likely to encounter somebody experiencing suicide risk factors or suicide warning factors. So when you think about that, of course, off the top of the head, you think mental health professionals, but in reality, we all encounter folks that are experiencing this, certainly in the helping professions. So mental health professionals, therapists, medical staff that works with mental health clients, and then even on the level of social worker or like case manager type position. I feel like the folks that are most frequently in front of the clients, which happen to be more that case manager type role, they're the ones that are probably going to pick up on a lot of this information before, let's say, a licensed therapist or a doctor or nurse practitioner would pick up on. So it's really important for even those positions that may not see themselves as a clinical role per se. So the same would go for even in the education setting, teachers or the paraprofessionals that work in a school setting, really all levels. I guess I can't emphasize enough those positions that happen to have just more face time around individuals. They're just such a profound source of information, and they're going to really be picking up on these warning signs before probably anybody else.
Yeah. I remember working in the school systems and definitely our high school and middle school students, but even some of the younger students we were seeing doing assessments for very young children in this area. So having that training and feeling like you know what to do, even if you are not the final contact, if you're just the gatekeeper, would probably relieve a lot of stress and fear when that does happen.
Mm-hmm.
You understand the process, you can explain it to them, what's coming next, who they're going to talk to. All of that can help alleviate stress for that person and for yourself.
Yeah, absolutely.
Anybody
Because
working with kids, young adults, anybody with mental health or physical health, chronic pain, for example, that's one of my specialties. 70% of people struggle with suicidal ideation at least once in their process. That's huge. 70%.
yeah, absolutely. Yeah. And I think, that's going to be a good chunk of the training, or at least I don't want to say time wise, but, value and weight wise, the training is understanding those folks that are more likely to experience suicide ideation or other risk factors. So that could be certain demographic populations, so age, gender. There could be different diagnoses as well, might have different rates or more commonly experienced suicide risk factors. And like you mentioned, chronic pain, there's certainly a whole host of medical conditions that would be a huge part in contributing to somebody feeling hopeless and starting to work down that line of considering suicide.
Yeah.
So it's a really broad reach. It's one of those things that it doesn't hold back with who it eventually touches at some point. It's a broad range of people.
Well, it's really relevant to all of us, and I think one of the big rules about suicide is that the more you talk about it, the better. Demystifying it, destigmatizing it, just knowing that this is one of the things that happens is so important. So this is a great opportunity to practice that and practice regulating yourself as you talk about and learn and feel empowered in this area.
Yeah, and when you talk about empowerment, I think of, there's going to be time where we're going to be talking about not just relying on one thing. There's a lot of ideas about different checklists, different screening tools, different versions of assessments. And so while each of them can be really vital and could be the thing that actually starts the conversation, at least, not relying on one thing solely and making kind of a really comprehensive approach to dealing with this. I think the more that we feel empowered, the more we feel comfortable using kind of a combination of tools instead of trying to really strictly rely on one thing that we might ultimately miss some important information.
That's great. I remember being new and being like, this SLAP acronym is supposed to be what's going to help me. Like, it's got to be harder than this. There's got to be more. And there is more, but those things are also tools. Yeah. That makes a lot of sense. And I'm sure, and we'll get more into this, but setting, who you're with, what resources you have. There's a lot available to support people that even just knowing about can help. Yeah. Well, thank you so much for joining us today. We're so excited to do this course because it's so important. And also, such an area that I think gets neglected, and it's just too important to neglect. So I'm happy that we get a chance to really do give it its due, and it's such important work, literally life saving. So thank you for doing this with us, and we look forward to the upcoming training.
Yeah, absolutely. I'm excited.